Brad Reed. I'm Director of Community Resource Development. Over my shoulder, out of view, you can't see, even when my camera's on, is Beth Adkins. Beth is Director of Prevention and Education. So she and I do a lot of the training and a lot of the resource sharing at the various events that we do. Beth, say hi.
Hello.
There she is. You can contact us at the board. Our main number is 937-335-7727. That comes into a main switchboard. Or you can reach us online at www.tcbmds.org. And if you're wondering where that web address comes from, it's the initials for Tri-County Board, Miami, Dark, Shelby. We are a 3-county board serving those 3 counties, although our office is based in Troy. I will talk about all of you are able to have on hand. All you have to do is request them, is the Tri-County Resource Guide. We developed this about 4 years ago initially at the request of our law enforcement agencies who like to have information that their road officers could have with them in the cruisers if they encountered somebody who was in crisis or who might need counseling support or treatment. So we compiled this into a brochure. We've done 5 printings of it. Each printing is about 3,000 copies. So we do have copies on hand pretty much all the time. There's also a downloadable PDF file at our website /resources that you can freely download and print yourself. There's also an online version that's searchable if you just want to look something up quickly. But it's a fairly comprehensive list of all the treatment providers and support services available to our residents in the 3 counties. Some of the resources are located out of our 3-county area, but they're available to people within our county. When the coronavirus pandemic really started to take hold in late March, early April, we decided we'd better start putting up some coronavirus pandemic specific resources. So we added a page on our website /coronavirus. And on that page, we are compiling general resources about the coronavirus pandemic, all the state hotlines, the state portals and websites, health departments in the 3 counties. We have general health and hygiene tips. And then we get into the mental health tips, including anxiety and depression. We're just collating these from resources as we get them. We have specific information for first responders and healthcare workers, a list of hotlines, warm lines, and text lines, information specific for kids and families, and then how to stay connected with some downloadable graphics and so on. So it's a fairly comprehensive resource list, but all specific to the coronavirus pandemic. Of course, our linchpin in our crisis services is the 24/7 Tri-County Crisis Hotline, 800-351-7347. If you don't have that in your cell phone contact list yet, please put it there. You never know when you might reach somebody who is in crisis and needs to talk to a crisis counselor quickly. We have business cards available. Again, all you need to do is request them and we will bring them anything from 5 to 500. You tell us how many you want and we will make them available to you. An important number to have on hand is the National Suicide Prevention Lifeline. They are probably the most used suicide prevention lifeline, certainly in the country, if not worldwide. It's 800-273-TALK. That's 8255. We have some limited materials, magnets, and little handout cards and things, but this is a number that everyone should have available in your employee workroom, break room, just to have if somebody's feeling that they're thinking about suicide and they need to talk to somebody. Without doing a whole suicide prevention training, I just want to state here, and then we can back it up later, with evidence if you ask, but talk may be the most effective way to prevent suicide. And people who don't have suicide prevention training tend to shy away from that, thinking, well, if I mention the word suicide, it might plant the thought in somebody's head, but the exact opposite is true. Talking about suicide is often the only thing that will prevent someone from actually acting on those thoughts. Related to that, the state of Ohio has partnered with Crisis Text Line. Crisis Text Line is a national service, but they have ways of segmenting it so that we can track statistically what happens in Ohio. It's free, it's confidential, and it's 24/7. The text line is operated by volunteers. Texting 741-741 will connect you with one of those volunteers. If you use the tagline "For Hope," that identifies you as coming from Ohio. The text conversation will proceed if it seems related.
You're breaking up a little bit, Brad.
Brad, are you still with us?
They will use caller ID and local for having the house to do. Shelby, am I still here?
You are. You are.
Okay. Got a note that the broadcast stopped.
Yeah, you were breaking in and out for a little bit.
If it happens again, just let me know.
Okay.
So did you all hear about this crisis text line, or do I need to do this again?
I believe we heard about that because you said that code is specific to Ohio.
Yes, that's correct. Thank you.
Sure.
Another local resource that businesses should be aware of is our crisis response team, the Tri-County CRT. What the crisis response team does is, in the immediate aftermath of a community crisis, and that could be anything from an event that involves a school or a neighborhood or a business, you activate the crisis response team, and 2 or more crisis responders can come on site, meet with your employees, meet with families, and so on to help process. It's more of a triage than it is a treatment. We don't really provide treatment on site, but our crisis responders are trained using a model developed by the National Organization for Victim Assistance to identify persons who are struggling, and they are referred to further treatment. We try to respond as quickly as possible, but certainly within 48 to 72 hours, depending on scheduling issues. I know we have responded to businesses for certain situations, such as an accidental death of an employee or someone who dies from natural causes on the job. We did a response to a business that had been the victim of an armed robbery, and their employees were struggling with coping with that. Really, any kind of crisis that affects your business is something that we would be happy to consider for a crisis response team. The way to activate the crisis response team is that a CEO or a building manager or someone who is responsible for that particular business should call the 24/7 crisis hotline, 800-351-7347. The hotline operators then will pass the information on to the crisis response team. And Beth reminds me to tell you, there's no charge to you for this service. It is absolutely free, and it does not supplant any services that you may receive through your employee assistance programs. We are merely there to assist and to provide connection to additional resources. Another resource I want to talk about is our problem gambling prevention and treatment. Again, for local help, call the crisis hotline. Online at our website /gambling, there's additional information. In Ohio, has an organization called Ohio for Responsible Gambling at 800-589-9966, and possibly one of the most confusing web addresses ever, org.ohio.gov. ORG does not stand for org, it stands for Ohio for Responsible Gambling. But the reason I bring this up specific to businesses is because compulsive and problem gambling is probably the single most root cause for embezzlement and other white-collar crimes involving theft from business. When we see stories involving large amounts of embezzlement from companies or organizations, more often than not, it will be traced to a problem gambling situation. So if you suspect that you have employees who are struggling with gambling, these are some resources that you might want to have available for them. Let's talk a little bit about training. Probably our flagship training that we're doing right now is mental health first aid. That's a full day training. It comes in a couple of different versions. One is for just a general audience or the adult audience. There's a version specific to adults who work with young people. So if your organization is specifically working with young people, you might want to consider the youth mental health first aid. The Tri-County Board is making that available to everyone at no cost. Some places will charge up to $170 for this all-day training. We're making it available at no cost to everybody in our three-county region. We consider it to be that important. We're currently not doing the trainings in person simply because of the COVID situation, but we are trying to get back on track. The National Council that manages mental health first aid requires us to have a minimum of 5 people per training, and our group sizes are limited to roughly 10, so that's a very narrow window for us to get these scheduled. But we are working with organizations to schedule. If your organization would have 5 to 10 people who might be interested in this, contact me or contact Beth Adkins, and we will certainly work with you to make sure that we can deliver this in a safe and healthy environment. Another training that we do for businesses, populations in general, is called QPR. QPR stands for Question, Persuade, Refer. And it's a training that can be delivered in anywhere from 1 to 3 hours, depending on the components and the audience. And Beth just yesterday did a 3-hour version of this for Shelby County Schools and did it online through Zoom. So this is one of the trainings that we are able to deliver and not be too concerned about the physical distancing. Again, this is very specific to suicide prevention, but you get many of the essential components of some of these other trainings in QPR. Trainings that we do for general audiences and that can be adapted to your specific business would be mental health basics, just understanding what mental health is, what are the origins for mental illness, what are some of the treatments available for mental illness, and so on. And we do those both for general populations and for youth-specific populations. We have training on vicarious trauma and self-care. This is really important now during the pandemic. Many people are absorbing the trauma of others that they work with and encounter. For instance, we heard very early on that a lot of our retail workers who were considered essential, such as the grocery store employees, were having frequent, difficult interactions with members of the public, being yelled at or verbally assaulted and so on. And it doesn't take many of those, especially if you're 16 or 17 years old, to really start to cause trauma. And what vicarious trauma and self-care does is helps people understand how trauma works, how it affects our brains and our behaviors, and what we can do to first kind of inoculate ourselves against vicarious trauma through building resilience, and also self-care just to maintain a healthy mental outlook. Related to that is training specific to de-escalation techniques. Certainly the news recently has been talking a lot about de-escalation. And what de-escalation is understanding the emotional state of a person that you're interacting with and knowing how what you do affects their emotional state. How you react to a situation can very much determine whether a person escalates into a position of violence or de-escalates into a position of compliance. And if you're working in a retail setting or you're working in another setting that interacts with the public, de-escalation techniques are very useful to have in your toolkit just to kind of keep the temperature down in some of these interactions. A little bit more esoteric maybe, but still important, is something called a trauma-informed approach. And we like to specialize the trauma-informed approach training to your specific environment. But what trauma-informed approach is in general is, rather than asking a question, what is wrong with you, you ask the question, what has happened to you? And from that, you gain an understanding of how a person might react and might behave based on their prior experience. And of course, any of these trainings can be customized specifically for you. And if there's a mental health related training that we haven't talked about that you would like to consider, contact me or contact Beth Adkins, and we will certainly work with you to see if we can't design something specific for your needs. Just as an FYI, some other specialized trainings that we do includes health officer training for our mental health professionals. That's related to the so-called pink slip, or the 72-hour hold, where someone is in a mental health crisis and can be detained for a short time pending an evaluation and placement into a longer-term care facility. That's very specialized, only for mental health professionals, but it is a training that we do here at the board. We also do a series of trainings for CEUs through our counselors, social workers, and marriage and family therapists to maintain their licensures. We provide those trainings at no cost to any of our contract agencies and at no cost or very little cost for other agencies in our 3-county area. Unfortunately, in recent years, we've had to develop training related to schools. We have a training called Preparing Your School When Tragedy Strikes. It helps administrators and staff know what to expect and how to manage the situation, to kind of control the narrative a little bit, if you will, and to make sure that the people who need help can get help. And related to that is how to provide grief support to schools after a crisis. And this is very much related to what the crisis response team does. But it helps the administrators and the staff know what is available and how it can be used. We have a series of specialized trainings related to law enforcement. The linchpin of that is the Crisis Intervention Team Academy for law enforcement officers. Each academy is a 4-day training. We bring officers in from all 3 counties. They get an opportunity to learn about mental health, mental illness, various specialized populations, including the elderly and persons with dual diagnosis with mental health and substance use disorder, or mental health and developmental disabilities. And then most importantly, teach them techniques for de-escalation. And then they get to practice those techniques through scenario training. And at the end of that, they are certified CIT officers. And there have been a number of situations over the years where our CIT officers have been able to de-escalate, help prevent suicides, and so on. And it's a really valuable training in our community. We've trained over 260 officers in our 3 counties since we've been doing that. We also have companion courses for behavioral health professionals, which is kind of a flip of the CIT Academy, where our behavioral health professionals get to see how law enforcement officers work and understand their powers and their limitations. And we have a CIT companion course for dispatchers, so that the people who are the first line receiving the 911 calls also understand things like de-escalation and getting information pertinent for our law enforcement officers. We have a traveling program called Hidden in Plain Sight. We've set this up at like employee health fairs. We do it at schools and so on. It's essentially a traveling teens bedroom. And in that bedroom, we have about 50 or 60 different, sometimes hidden, sometimes obvious signs of possible substance use or other risky behaviors. And we invite people to go through open drawers, look under the covers, and find what these various things are. Not surprisingly, vaping and vaping paraphernalia is a particular interest right now. That's something that we can bring out and set up if you have an employee health fair. We do limit it to adults. We don't want to give the kids any more ideas than they already have. We do some school-based prevention programs. And then that brings us to questions. So